The real explanation for why colonoscopy is a lot more challenging in women, and I can tell you, as somebody who's done thousands of colonoscopies, that that is definitely the case, but it has nothing to do with differences in pain threshold and everything to do with anatomical differences between the female and male colon. I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. On today's show, I'm going to explain why women have so much more bloating and constipation than men. And you might be surprised to learn that the reasons are primarily anatomical rather than hormonal or food-related. There are some major differences between the male and the female digestive tracts that explain why women are so susceptible to bloat and backup. I see both men and women in my gastroenterology practice, but I see a lot more women than men, and that means I do a lot more colonoscopy in women. Anyone who thinks women are just smaller versions of men has never been inside the female colon. The typical female colon has multiple twists and turns and switchbacks and loops that can be very challenging to navigate with a colonoscope. It takes me, on average, twice as long to do a colonoscopy in a female patient compared to a male. If you are a woman and you suffer from bloating and constipation and you've had a colonoscopy, you may have been told after the procedure, or it may be noted on the colonoscopy report that you received after the procedure, that you have a tortuous or a redundant colon. Now, I don't know about you, but I would rather not have my body parts described as tortuous or redundant. So I tell my female patients with the twisted, loopy colons that they have a voluptuous venous colon. I think it has a nicer ring to it than tortuous and redundant. If you review the scientific literature, you'll see lots of articles about colonoscopy being more difficult in women, about colonoscopy requiring more sedation in women, and about colonoscopy taking longer to complete in women. These things are all true, but those differences are often attributed to women having a lower pain threshold than men, something I find hard to believe given the fact that many, if not most women, go through labor with no anesthesia, and there are over 100 million babies born every year. The real explanation for why colonoscopy is a lot more challenging in women, and again, as somebody who's done thousands of colonoscopies, I can tell you that is definitely the case, but it has nothing to do with differences in pain threshold and everything to do with differences in anatomy between the female and male colon. And coming up, I'm going to tell you exactly what those differences are and what you can do to overcome them. The Gut Bliss podcast is brought to you by Visbiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, Visbiome can help. It's a medical food for the dietary management of IBS and gut inflammation, backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with Visbiome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. The first thing you need to know is that women have longer colons than men, on average about 5 inches longer. Now, that might not seem like a big difference, but those extra 5 inches lead to a lot of additional loops forming in the colon. And that's part of what makes colonoscopy more challenging, is trying to navigate through those loops. And the loops don't form only during a colonoscopy. The female colon is also prone to loop formation at other times too, like during digestion when the colon is full of gas or stool. The products of digestion end up getting stuck in these loops, and gas builds up behind the area in the colon where things are stuck or slowed down. And that can lead to a lot of bloating, discomfort, and constipation. In fact, the pain from the stretching of a full segment of colon can lead to what's called a vasovagal reaction, where the heart rate drops, you feel sweaty, you feel nauseated, you feel dizzy, some people even pass out. And this can occur in people with extreme constipation and bloating when the colon gets really full. And that stretching of the colon triggers the vagus nerve, the 10th cranial nerve, and that's what drops the heart rate, makes you dizzy, sweaty, etc. A vasovagal reaction can also happen after colonoscopy if your gastroenterologist isn't paying attention and doesn't suck out all the air that they've pumped into your colon during the procedure. So this extra long colon sounds like a lot of pain and discomfort and bloating and inconvenience. So why do women have a longer colon? What's the reason? Is it just a design flaw? The main reason for the additional length is to allow for more absorption of fluid during pregnancy to maintain the amniotic fluid that the fetus is floating in. And I want you to remember that one of the important functions of the colon, in addition to transporting the products of digestion out of the body, is to allow water from the stool to be reabsorbed through the lining of the colon back into the body. So this extra length of colon leads to extra fluid reabsorption, and that helps to maintain the amniotic fluid during pregnancy. The second important anatomical difference in women is that they have a more rounded, deeper pelvis. And so in women, the colon drops down into the pelvis where it has to compete for space with a lot of other hardware, the ovaries, the fallopian tubes, the uterus, and the bladder. That's a lot of organs in a relatively small space. And that can lead to even more looping, crowding, constipation, and bloating. The colon has to go around all these organs. Men have a much narrower pelvis, so their colon does not drop down as deeply into the pelvis. It's located more in the abdomen where there's more room. In men, their reproductive organs also take up a lot less space. They just have a little small prostate gland about the size of a walnut, so things are much less crowded. So again, you might ask, why this difference in pelvic size and structure? What is the reason for this difference in the shape of the pelvis that causes more bloating, backup, constipation, and congestion in women? And again, the reason is childbearing. Women have a wider, deeper pelvis so that they can accommodate an additional human being down there when they're pregnant. Men don't have that need, so they have a narrower pelvis. The difference between the wider female gynecoid pelvis and the narrower male android pelvis is really striking. You can identify a female versus a male skeleton pretty easily when you see them side by side, just based on the shape of the pelvis. So far, I've outlined two major anatomical differences between the female and the male colon: a longer colon and a deeper, wider pelvis in women. But there's a third difference that causes women to have way more bloating than men. And while this one is also anatomical and it's structural, its origins are hormonal. Men have higher levels of testosterone than women. Women also have testosterone, but we just have less. Higher testosterone levels leads to an abdominal wall that's more muscular and defined, and that buttresses the colon, and it prevents it from forming extra loops, and that helps to keep things moving through more smoothly. It's sort of like a Spanx. So men have a Spanx that's tight, like a brand new Spanx. And women, we have a slightly more stretched out Spanx because of the lower testosterone levels. So even men who have a bare belly, they will still have a relatively tight abdominal wall underneath. And they will complain about being overweight and having a bare belly, but typically not about being bloated. If we think of a visual representation of the colon, the male colon looks like a horseshoe, sort of a gentle curving. The female colon looks like a Six Flags roller coaster, up and down and up again and back down and curving around. If you have a voluptuous venous colon, and I want to be clear, even though this is more common in women, men can also have a tortuous, redundant colon. So if you have one of these loopy colons, you may find that doing things that are supposed to make you less bloated and constipated, like eating more fiber, can actually make things worse. Why? Because these big, bulky, fiber-filled stools can get stuck in all these loops in the hairpin turns and cause a lot of discomfort and backup and bloating. So you need to modify your diet. Now, I want you to keep the total intake of fiber the same because fiber is critical for feeding those gut microbes that help to keep us healthy. But I want you to spread your fiber out throughout the day. So instead of eating one super large salad or a big bowl of rice and beans at one sitting, think about splitting that up into 2 smaller meals. I also want you to ramp up your water consumption. At least half your body weight in ounces of water plus some extra. Remember, plumbing. The GI tract, it's simple plumbing. It's tubes. They go from top to bottom. Liquid helps things move through when the pipes are clogged. Some of my patients, when their bowels get backed up and they start to become really bloated and constipated, benefit from doing a liquid diet for a day or two. Green veggie juice, broths. This is the one time where I would recommend that somebody do a green juice as opposed to a green smoothie, because when they're really backed up and clogged, we don't want to add more fiber into an already clogged system. So this is a time when thin liquids, again, broth, some thin soup, water, tea, a green juice, can help to sort of clear things. Sometimes people need to use even more powerful medications, things like osmotic cathartics that help to draw fluid in to clear those pipes out. Occasionally, I have even had to prescribe a full bowel prep, like somebody would take before a colonoscopy, for a patient with a voluptuous venous colon that is full of stool. But I highly recommend not letting things get to that point by considering doing a day or two of liquids instead of having to blast your bowels with medication. So I want to leave you with 3 takeaways about the voluptuous venous colon. The first is that a longer colon, a deeper pelvis, and a generally less defined abdominal wall can all add up to more constipation and bloating in women. The second thing I want to tell you is that you should spread out your fiber and ramp up your water consumption if you are having a lot of symptoms of bloat and backup and you've been told that you have a twisted, curvy, tortuous, redundant, or voluptuous venous colon. And finally, if you get really backed up, consider doing a liquid diet for a day or two to give your curvy colon a chance to empty and decompress. So that's it for this edition of the Gut Bliss podcast on the voluptuous venous colon. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut. Coming up next week on the Gut Bliss podcast, introducing chemicals into delicate ecosystems like your vagina or armpits in an effort to cleanse or refresh or improve your body's natural state usually backfires and produces an opposite effect: microbial imbalance and more problems.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.